Last week, the World Health Organization said that just 15 out of 54 African countries had fully vaccinated 10% of their populations against COVID-19. The announcement that more than 70% have missed the World Health Assembly's target indicates that there is a struggle to narrow the large gap in vaccine access between poor and wealthy countries. Dr. Jamiu Ganiu, a public health physician, joins us for more on this on the program virtually. Thank you for joining us. Tell us, what are the risks that these countries face falling way behind the WHO target?
Thank you very much for the question. Is 10% of vulnerable that ought to be vaccinated at the end of September 2021. It's not really it's mainly targeting the vulnerables, and that is 10%. If you look at among those 15, based on the report, majority of those people that are able to achieve the 10% were mainly those countries with a smaller population. For instance, we are talking of countries like Lesotho, Botswana, South Africa, and so on. But when you look at the country with a bigger population like Nigeria, Ethiopia, and Egypt, is that population is a key factor. They are yet to meet. Like Nigeria has less than 3%, Egypt around 5%. So it's more relatively the population actually has been attributed to one of the factors. And apart from that, getting this vaccine currently, especially for Africa, they've not been able to meet the target in terms of supply. Currently, out of over 5 billion doses that have been distributed, Africa were mainly giving about 2 to 3%, which is actually a big problem. And before now again, we in Africa, we depend on either donation, on a COVAX scheme distribution, or based on the individual country negotiation with the manufacturing company. But unfortunately, if you are following antecedents, you find that the major supply of these vaccines is Serum Institute of India. Sometime in April, they had an issue. There was a serious outbreak, increased number of cases in India. As a result of that, they have to suspend exportation so that they can take care of their own people that are being affected. And hopefully, they hope to resume by October to continue, producing those vaccines. And even when hopefully they resume in this month, it has been said that they will first deal with the Asians and the COVAX. But I want to let you know that depending on donation, COVAX scheme has been one of the actually limiting factor that has made Africa to, at present, the average vaccine coverage in Africa is about 4.4%, compared to Europe with 66%, 62%. UK
and other regions.
66%.
Dr. Ganiu, I must quickly ask you, I mean, although Africa's third wave peaked in July and the decline in new cases appears to be a bit slower than the previous waves which we've had, and statistics are showing every hour 26 Africans are dying from the virus, is there a threat that, there could be new variants, and this is with the vaccine's delay?
No, what is possible, but currently you know that we have 3 basic variants actually, causing transmission in African countries. The Delta, which is there. We have the Beta and we have the Alpha. So, well, it's possible, but the only painful thing is that there is a general hoarding of these vaccines by those countries who can afford it, and that has been a major problem. And even, the global target for this vaccine has been stated is 40%. It is expected that at the end of 2021, we should be globally we should achieve 40% coverage. But unfortunately, it's possible to have already there is a suspicion of a new variant, but it has not been established, because what determines a variant has to do with the increase in transmissibility, the severity, and the ability to actually affect the vaccine protection. But the current one, C12, up to now is still under study. There is not any evidence that yes, it can cause any further problem at the moment. Yes.
We always appreciate your time on the program. Dr. Jamiu Ganiu, a public health physician, thank you for joining us.
Thank you very much. Yes.